I want to talk about the science and community spread. If anything, as you know, that has been my job here from the beginning. There is a fallacy out there, and it is so important that we move past this. There is a fallacy that Middle America is not impacted by this to a large extent. We know, as I told in an earlier taping, and if you want to go back and look at that, we are a state of 11.7 million people, the 7th largest state, a sister state of Hubei province, with extensive businesses with global impact, with extensive universities, public and private, with students and professors in exchange. And everything points to the fact that we had a seeding of this infection early on, and we were one of the last states to get the reagents we needed to do testing. And our case numbers are a history snapshot of the past. They are not telling the full data and the full story of what is happening here. And I need you to look at what's happening on the ground to understand the full impact of what is happening here. It was, in fact, like I've said before, it is the seeing a star at a distance. You're seeing a snapshot of the past. Even what goes on in the future in the next few days is still minimal because we are conserving all our available testing for the most high-risk and hospitalized and frontline workers. So we are withholding the most of our testing in our lab because we are running out of reagent. And believe me, we have ingenuity here. Believe me, Ohio State, Cleveland Clinic, and others are inventing every component of the testing kit. But you are looking at a snapshot of history. The work by the modelers that the governor showed, the charts that were in the New York Times, they are a snapshot of what's going on in Ohio, because even the modelers are having to use the best data they can get, and that is incomplete data. So it's very, very important to realize that we have now 247 confirmed cases, a snapshot of what's going on. We have onset of illness from February 7th to March 19th. We have an age range of age 1 to 91, with an average median age of 51 years. We have 58 people hospitalized, multiple in ICU. We are taking people off of ventilators in Ohio. We have 3 confirmed deaths today and multiple that are still under investigation and have already been reported to the media but have not come into our data center yet. We have 31 counties impacted, knowing full well that people are coming from other counties and being recorded in larger medical centers. We have hot spots in nursing homes on the ground in Dayton area, in Tuscarawas County, in a small area of Ohio, and in Cuyahoga County in Cleveland, in a big city. We are seeing this on the ground. I sometimes feel that I am in a war zone, I'm going to war, and I'm coming back home and wondering why everybody at home doesn't see what I see, because you can't see the scurry and the flurry of activity that's happening on the ground at the local level. I implore the media, you help us so much in this, to go to the local level and see what is happening. I want to tell you about innovation that's happening in Middle America right now. I want you to go to Cuyahoga County and talk to Health Commissioner Terry Allen and his medical director, Heidi Gullett, who's head of the Preventive Medicine Program at Case Western Reserve University. I want you to talk to them about their amazing 5-layered triage system where they are following cases, presumptives. They are creating whole tiers of doctors trained in preventive medicine who are taking on each high-risk nursing home in their area and long-term facility. And there are a new army of people out on the ground doing case histories and contact investigations. They are doing surveillance in high-risk clusters. Without all the available testing, they're using their tests wisely, and then they are going even to family clusters. You need to tell the story of these innovators on the ground, and we need to get over this thought, yes, we are behind Washington by days, by a week. We are behind New York in seeing what they're facing, but we have to take the recommendation of these modelers. We have to take the recommendations of the best available data that we have from Dr. Shaman, from Northeastern University in Boston, Dr. Vespignani. We have got to realize what they're saying to us, that those of us who have the days, not weeks, to take these measures need to take them now. We will benefit most. Others did not have this opportunity. I want to say that these measures we're taking, we are equally working with the best scientists and people around the world to figure out the economic impact, because it is no small thing. Every one of these decisions has rippling consequences, cascading effects. It has effects on people's health every time we have to make one of these changes. Vulnerable people are the most at risk, and we're looking at that social vulnerability index. We are working with our nonprofits and philanthropy, and you'll hear more and more in days to come. These are hard choices, but these are the best tools we have, and we must use them now. We are seeing endless good deeds as well, and I just need to do a shout out. I told you yesterday about a bakery delivery that did not happen to a nursing home overwhelmed right now. I want to tell you that Gordon Food Service and Klosterman Bread stepped up. They'd made deliveries to the nursing home. Hampton Logistics, a small business carrier, said that they could transport 2,000 pounds of anything needed delivered. We do have an emergency operating system. We are building logistics that have never existed before, because this is an unprecedented public health emergency, and folks are stepping up. I heard a story in the Columbus Dispatch of a small business that was still doing carryout, but was saying goodbye for the last day, and of a customer who overheard that and left a $2,500 tip to help the workers there. So this is absolutely the truth. Human and economic development, they're inextricably linked, and every one of these decisions is going to take the best scientists and the best people helping us remove what we can when we can, and I want to work with you on that, and so does my team. Ohio, we've talked about the hurricane analogy. We've talked about the fact that you want to evacuate while the sun is still shining. We talked about how difficult it is to build these systems when it's in the middle of the eye of the storm. We are in increasingly heavy rain. This is the time to batten down your hatches. This is the time to stay at home in place. And I look forward to working with all of you in the days to come.